Aloha! Thank you for joining me today. So I'd like to welcome you to our Facebook Live presentation. My name is Dr. Catherine Taketa-Wong, and I'm a naturopathic physician and acupuncturist. And for those of you who aren't familiar with what a naturopathic physician is, we are trained as primary care physicians. And as such, I can order lab tests, write prescriptions, do school physicals, just like other doctors. However, a big difference is that naturopathic doctors are trained in using diet, nutrition, vitamins, herbs, and other types of natural medicines to address the underlying causes of disease and treat the whole person. So I also have a master's degree in Oriental medicine, which allows me to include Chinese medicine and acupuncture in my treatment protocols. So today, I'll be talking about gluten. And it is potentially one of the most controversial health issues. And gluten specifically, what is it? A lot of people have heard about gluten. Maybe you've seen in the stores all these labels that say gluten-free, gluten-free this, gluten-free that. And some people think, oh, well, that must mean that gluten-free is healthier. So I just want to talk and clarify some of those things and common misconceptions, but also talk about ways that gluten may or may not be problematic. So what is gluten? Gluten is one of the proteins that's in wheat and other grains that give it its elasticity. So it is also in other grains, so that includes rye, barley, and oats technically do not have gluten, but they do have a protein that is similar to gluten. And so there are some people who have a sensitivity to gluten, and even the protein in oats, because it's similar enough, it does actually cause problems. And so I'll talk a little bit more about that later. So in people who have celiac disease is an autoimmune disorder, and it causes the immune system to attack gluten, where the immune system thinks that gluten is something that's really bad. And so it causes a lot of inflammation and damage to the small intestines and other areas of the digestive tract, potentially, primarily though in the small intestines. And it can cause diarrhea, abdominal pain, vomiting, fatigue, headaches, and then many more potential other symptoms. One thing to realize, though, is that there are also milder forms of reaction or an allergy to gluten or to wheat. So this includes what we call a food sensitivity or a food intolerance. And there are many different ways that symptoms to gluten can manifest. So that can cause what's termed brain fog, where people say, I just feel like my brain is kind of in a fog. I feel like I have difficulty being able to think clearly, being able to concentrate. I just feel like my brain just isn't kind of working normally. So that's one thing. Other people have abdominal pain. They have bloating, diarrhea, constipation. I have seen people who have gluten sensitivities where one person may have diarrhea and the other person may have constipation. And I'll discuss a little bit more about that and talk about that, about why that can be. Some people have headaches. Some people have bone or joint pain. Some people have chronic fatigue. Other people may have difficulty in terms of being able to concentrate well. And I also see it being a common issue in many autoimmune conditions. And so again, I'll talk a little bit more about that too. So one question is a gluten-free diet healthier for everyone? And why are the numbers of people who have problems with gluten seeming to skyrocket? Where do farming practices, fertilizers, pesticides fit in? So that's what we're here to find out. So I have just a couple of housekeeping announcements. The next Facebook Live event will be on September 10th. So we're taking Labor Day off. So the next Facebook Live event again will be in 3 weeks. And also feel free to use the comment section to ask questions as the talk progresses. And also I wanted to let you know that if you do have health concerns, if you'd like to talk to me about those things, we do offer a no-charge phone consultation. So the 15-minute phone consultation is where we get a chance to talk about your condition and then come up with a plan to see how I can help you the most. So arranging a consultation is very easy. Just call our office at 808-783-0361 and let our staff know that you're interested in arranging a no-charge phone consultation. Okay, so let's get started. So first of all, as I mentioned, there are issues where people have actual celiac disease. And this is well recognized in conventional medicine. Typically, that's diagnosed and discovered pretty early, because for most patients with celiac disease, the symptoms are very dramatic and often very debilitating. So we often see that even if a person gets a very tiny amount of gluten, then they get explosive diarrhea, they have abdominal pain, they have vomiting, there's significant fatigue, and some people may have blood in the stools. And so it's typically something that is pretty debilitating. So I've seen a lot of patients where they go to doctors and they say, well, doc, I think that I'm having problems with gluten. I think that it's giving me problems. And so then, conventional doctor may screen them for celiac disease. And there are specific types of tests, blood tests, and then also the gold standard for testing for celiac disease is by doing a biopsy in the intestines. And so that does require doing general anesthesia and having a procedure where they go in and then they take a small tissue sample from the intestinal lining, and then they look at it under a microscope and do some other tests. And that is really the gold standard in terms of diagnosing celiac disease. So there are a number of people who do have celiac disease, but what's often not recognized in conventional medicine is that many, many people have sensitivities to gluten where they don't have celiac disease. So they go into their conventional doctor, their doctor tests them for celiac disease, and they say, oh, it's negative. You don't have issues with gluten. Don't worry about it. You don't need to avoid gluten. And I will say that there are actually many other ways that people can be sensitive to gluten. I see that all the time in my practice. A very common one that I see is children with autism. So that is one of my specialties, is working with children with autism, as well as other developmental conditions, so Down syndrome and other developmental disabilities. And I see many, many children, especially with autism, who have issues with gluten. And the vast majority of children that I see with autism who have issues with gluten, most of them are negative for celiac disease. And they may have gotten tested for celiac disease and all the markers are negative. And they don't have, they may not have the typical symptoms that you would see with celiac disease. More children with autism that I see tend to have constipation rather than diarrhea. And so even just with that, many conventional practitioners will say, oh, you don't have issues with gluten. So I just want to let people know that there are other types of tests to check for gluten sensitivity. So one of those is an actual allergy test. So this is a blood test where you're checking to see if your body is making a protein called IgE, which is an actual allergy to wheat or to gluten-containing grains. So you can have an allergy test done. It can be done by a blood test, or it can also be done by skin scratch testing with an allergist. However, again, most of the children that I see with autism, and many individuals, many adults who may not have autism but have other issues with gluten, most of them are negative for an allergy to wheat or gluten. But it's still helpful to check to see if that's the case. There are other types of antibodies. There's another one called IgG. And that is one test where that's something that can cause also an immune system reaction, where your body is reacting to gluten. Your immune system is attacking gluten. It thinks that it's something bad. and it can cause symptoms. So with IgE, the allergy, typically with that we see the stereotypical allergy symptoms where people may have hives, they have sneezing, they may have itchy, watery eyes or nose. They may also have abdominal pain or digestive symptoms, typically more diarrhea. And they may also have skin rashes. That's with an IgE allergy. With IgG, the symptoms can be much more vague and much more generalized, because with IgG, that is one of the things that we talk about, a food sensitivity. And with food sensitivities, it can basically be something that is creating more inflammation in your body. So that's something where you can have, as I mentioned earlier, brain fog, abdominal pain, but pretty commonly we see that constipation as well. Some people have diarrhea, but a lot of people have constipation. Some people may have headaches, like I said. Some people may have difficulty sleeping or maybe getting sick all the time, chronic infections or chronic fatigue. So those are things to also consider. And so that's what I typically see with an IgG reaction. And there are different ways that you can have reactions in terms of looking at the IgG. So there are different types of IgG tests. So there's one that can be done. And so one of those is called a deaminated gliadin. So that's one thing that you can test an IgG for. There's also something called anti-transglutaminase. And so there are different types of tests that we might look for. So those are, there are actually many more types of IgG tests regarding gluten. There are different components of gluten, but those are some of the main ones. So another way that people can have a sensitivity or an intolerance to gluten is that they may not have the enzyme to break down gluten. And so one of the main enzymes is an enzyme called DPP4. So D is in dog, P is in Peter, P is in Peter, and then the Roman numeral 4. So DPP4 is the enzyme that's responsible for breaking down one part of gluten. And one part of the gluten molecule is called gliadorphin. And it's called gliadorphin because structurally it's actually similar to an opiate molecule or to morphine. So the gliadorphin, the orphan part, comes from the structural similarity to morphine. And so it actually is similar to opiates. And so opiates are things like morphine, Vicodin, heroin, codeine, not codeine. So there's a number of different medications that are opiates. And so people can have issues with gluten because they don't have the enzyme, which is called DPP4, to break down gliadorphin. And because gliadorphin structurally is similar to an opiate molecule, what can happen is if you don't have the enzyme to break down gliadorphin, what happens is when it gets through the body, your body doesn't break down the gliadorphin. And then what can happen is it can actually cause effects in the body that are similar to an opiate molecule. Because it is structurally similar to an opiate. And if you think about when people take morphine or Vicodin, what happens, many times they get constipated because the opiate molecules are slowing down the processes. They're slowing down the firing of the neurons in our brain. And they're also slowing down the nerve stimulation to the gut that helps to move the food along. And so what happens when people take morphine or opiates or Vicodin is that their brain isn't firing as well as it normally does. And so what happens is people start to have kind of a slower reaction. They have kind of like decreased cognition where they're not processing at their normal speed. They're not able to respond to questions or to conversation at their normal speed. And also what's slowed down is the nerve stimulation to the intestines, which helps to move food along. And so what happens then is that they get constipated. So just like how people can get constipated when they take opiate molecules, if someone doesn't have the enzyme to break down gluten and the gliadorphin part of gluten stays intact, that can actually cause constipation, and it can also cause slowed cognition. So it's kind of like the brain fog that I talked about, where it's like their cognitive function is just slower than normal, and they're not responding as well. And I will tell you, I've seen a number of children with autism who, when we took gluten out of their diet, or if they took other types of food sensitivities out of their diet, but gluten is a really common one. I've seen a number of children, when we take gluten out of their diet, that their constipation resolves and they're fine. Also, I've seen many children with autism where parents say, oh, after we took gluten out of their diet, it was kind of like he came out of a fog, and he started being more aware. He started responding to us, and before I would just call my son's name over and over and over, and he would never respond. And after we took gluten out of the diet, it was like he would respond to his name. He'd look up and then he'd say yes, or he'd come. And so I've heard that many times. I have also seen many people without autism, but with a number of other conditions. So chronic fatigue, like I mentioned, digestive issues, headaches, migraines, abdominal pain, joint pain, difficulty sleeping, chronic infections. I've seen many people where, if they do have a sensitivity or an allergy to gluten, and we take that out of their diet, then we do see improvement in their symptoms. So another one that I also wanted to mention was autoimmune diseases. And autoimmune diseases are conditions where your immune system is attacking your own body. So normally our immune system is supposed to attack bacteria and viruses and yeast, things that can cause disease. But in an autoimmune condition, then your immune system is actually attacking your own body. And that can cause, of course, a number of different problems. So rheumatoid arthritis is one example of an autoimmune disease where the immune system is attacking the joints and the tissue around the joints. And so that causes joint pain, redness, swelling, inflammation. Another autoimmune disease is lupus. And in that condition, the immune system is attacking the skin and the connective tissue and other types of what are called mucous membranes, or other tissues like around the eyes or the mouth or other places in the body. It can also attack the organs in the body. And there's a number of other autoimmune diseases. There's one called Hashimoto's thyroiditis, where the immune system is attacking the thyroid gland. There are conditions like Sjogren's disease, where the body is attacking the parts that make the saliva in our mouth and the tears and other parts of the body. And so in Sjogren's disease, and people have chronic dry eyes, dry mouth, and a number of other symptoms. So, and there are many other autoimmune conditions. It's kind of too many to name. But I will say that interestingly, gluten seems to be one of the top sensitivities that I see with autoimmune disease. And I have seen a number of patients with autoimmune conditions where when we take gluten out of their diet, they improve and they notice noticeable differences. I've had patients with autoimmune diseases tell me, oh, like I don't have as much fatigue, I don't have as much joint pain, I'm able to sleep better at night, I don't have headaches. And so there's a number of patients that do report they do feel significantly better. And I will say that gluten is probably my number one thing that I'll look at in terms of food when I'm working with autoimmune diseases. So that's a really big one. Sugar is another big one. Refined sugar. with autoimmune diseases. But then it comes to the question: is a gluten-free diet healthier for everyone? I mean, should everyone just eat gluten-free products? I will say no. I don't think that gluten is an issue for everyone. Some people say, "Oh, it's just a fad." There's all these gluten-free products. It's a marketing gimmick. And I do think that there are a number of manufacturers who have kind of picked up on the gluten-free craze and will say gluten-free just to make their products sell more. One thing that's important, though, is to know that a gluten-free diet, it depends on the types of foods that you're eating on a gluten-free diet, because you can have a gluten-free diet that is full of processed foods and junk foods that is gluten-free, and it's not necessarily healthier. And especially a lot of the processed gluten-free products. So like gluten-free pastas, for example, often those are made from rice or corn. And there's a lot of different gluten-free products, gluten-free cookies and things like that. And while those can be helpful for some people with gluten, especially for a lot of children who, especially children with autism who can be extremely picky, and it's really hard to get foods into them, those could be a stepping stone. But I will always try to advocate for a diet that is based on more whole foods, and rather than depending on a lot of processed gluten-free products. So rather than going to like a gluten-free pasta and gluten-free cookies and gluten-free bread and gluten-free pancake mix, I'll tell people try as much as possible to get foods that are just naturally gluten-free. So, doing a lot of vegetables, fruits, organic meats, nuts, beans, seeds. These types of foods are naturally gluten-free. You do have to read labels. You do have to watch for sauces or other things that are added. There are many sauces and flavors and other kinds of things that will have gluten added. So that's certainly something that you want to watch out for and be careful to read labels if you do have a gluten sensitivity or an allergy. But I will say that gluten-free is not necessarily healthier. And just because a product says it's gluten-free, that doesn't necessarily mean that it's a healthy product either. And most of the healthiest foods, like vegetables, if they're just in their natural form, they won't have a gluten-free label on them because they're not a processed food. So don't necessarily think that gluten-free, because it says gluten-free, is healthier. As I mentioned, very often rice and corn, those are ones where they're, especially rice is a very high carbohydrate food, and if you go to a gluten-free food that just has rice everything, then it can increase the carbohydrate count. And there are also concerns with arsenic in rice, and so sometimes that can be problematic. So one other thing that I wanted to mention is something that's called gluten cross-reactivity. And so with cross-reactivity, that is that the body is reacting to, it may be reacting to other foods that are similar to gluten. And I would say the most common foods that I see with that are commonly soy, corn, and rice. And I'm not exactly sure why that is. Some people do have cross-reactivity to quinoa and buckwheat as well. So those grains are naturally gluten-free. So rice, corn, quinoa, buckwheat, and then and soy, and then also oats. I mentioned oats as well earlier. So oats technically do not contain gluten in and of themselves, but oats are often grown together and processed together with wheat. And so for that reason, there are many people who still react to gluten, who have problems with oats. There are gluten-free oats. Some people do fine with gluten-free oats, and some people still have problems with gluten-free oats because there is a protein in oats that is similar enough to gluten that sometimes there is that cross-reactivity. And sometimes that can be the case for some people with that they are cross-reacting to soy, rice, corn, and sometimes even quinoa and buckwheat. So those are ones to be aware of, that those can be problematic. And so I have some people that say, I took gluten out of my diet and I, did all these gluten-free products, and I didn't feel any different, you know. And so one of the things is that I will often test for reactivity to other types of foods to see if the other foods could be an issue or if a person is cross-reacting. And it could be that someone may have issues with the rice or the corn or the soy. And that's, and so that's why if they just went to a gluten-free diet that was full of processed foods that had a lot of wheat, corn, or soy, or sorry, not wheat, corn, soy, corn, or rice, that's why they could not have noticed any improvement with doing a gluten-free diet. Another thing that I like to point out is that some people say, I tried a gluten-free diet for a week, or maybe I tried it for a month or 2 months. I didn't notice any difference, and so we just went back on gluten. And one thing is that the protein, the gliadorphin protein that I talked about, so gliadorphin technically is something called a peptide. It's a piece of a protein, and it's part of what makes up gluten. But gliadorphin, it can take a while for it to get out of the body from the time that you stop eating it. So it can take up to 6 to 8 weeks sometimes from the time that you stop eating gliadorphin, or from the time that you stop eating gluten, for gliadorphin to completely get out of the body. And so if it takes 6 to 8 weeks, then say someone who's been on gluten-free diet for 2 months, that's 8 weeks. And they say, I didn't notice any difference, so I just started back on gluten. But a 2-month trial is really not sufficient if you're trying to do a trial to see if you are sensitive to gluten. Because if you have, say, the issue with not having the enzyme DPP4 to break down gliadorphin, then once you've hit 8 weeks, that can be the point that you're just starting to actually get the gliadorphin out of your body, and you won't notice any improvement until you've been off of it completely for at least 3 months. So I tell people if they're doing an elimination diet, for which basically means taking gluten out of their diet for a period of time and then reintroducing it, I will tell people if they're doing it that way, if they're not doing tests, then they really need to do a strict gluten-free diet for at least 3 to 6 months. And then you can reintroduce gluten after that. So just keep in mind that, an elimination diet that's 2 months or shorter, it really is not sufficient to see if you have an issue with gluten. So that's one thing. Another thing that I want to mention is the farming practices and the genetic modification of wheat. So one thing with wheat is that it's in America anyway, it's highly genetically modified. So one of the ways that they have genetically modified gluten, or wheat specifically, is that they have made it Roundup ready, meaning that it is resistant to Roundup. So what can happen is that the farmers can then spray huge amounts of Roundup on their crops, and then all the weeds die, but then the wheat doesn't die. And so then they can then go harvest that wheat. But you have to keep in mind that means that wheat, if it is, if it's genetically modified and if it's not organic, it has huge amounts of Roundup that have been sprayed on it. And there was a research arm from the World Health Organization that did a study and found that the main component in Roundup is called glyphosate. And that research arm of the World Health Organization recently declared glyphosate to be a human carcinogen, meaning that it can cause cancer. And so that is something that I find pretty disturbing, that that there is basically glyphosate, which is sprayed on our wheat, and it's also sprayed on corn and soy that is genetically modified, and other essentially other grains or other foods that are genetically modified as well. So, personally, I think that some of the intolerances that we're seeing to gluten come from the genetic modification, and that wheat that is not organic and that is genetically modified, that has the glyphosate in it. That's not something that's good for our bodies, certainly by any means. I don't think anyone would argue that glyphosate is good for our bodies. And certainly, definitely potentially problematic. So in terms of the glyphosate, there are people who seem to only react to gluten if it is not organic. And there are some people where I've seen where if they switch over to organic wheat, and in that process, I usually also recommend doing organic soy and corn and other grains and trying to avoid genetically modified foods, especially those that are genetically modified to be Roundup ready. So, that's one where people can have issues with gluten. And I have a few interesting stories to share with you from my clinical experience. These aren't research studies, but I think they're pretty interesting observations. So I had one woman who came to me. She had an autoimmune condition, and she was in her 40s, and she had very dramatic reactions to gluten anytime she would eat gluten in the United States. She would get dizzy, she would feel fatigued, she would have joint pain. And so when she took gluten out of her diet, she definitely noticed a significant improvement. She also took corn and soy out of her diet as well. And there are many people with autoimmune conditions where they seem to have reactions not only to gluten, but also to all grains in general. And so I see some people with autoimmune diseases who do better when they go on a grain-free diet. So, but this particular patient, she definitely had very clear reactions to gluten. And if she accidentally got gluten, she would definitely know, because she would get these symptoms again. She would get the fatigue and the joint pain and dizziness. And so, I've been working with her. She was doing well, and she went on vacation to Europe. And in Europe, they have banned genetically modified foods. And so she said, I'm going on vacation to Europe. I'm just going to eat the bread and the cheese, and, I'm going to be on vacation. And so she went on vacation and she ate the bread and she was fine. She had no reactions to the gluten there. And then she came back thinking, oh, well, maybe I can eat gluten now. She started eating gluten here in the United States, and boom, her symptoms came back again. And so I also had another patient who was a child, a young boy with autism, and same thing, very dramatic reactions to gluten. He would have meltdowns, he would have tantrums, he would have constipation whenever he ate gluten. The parents said that he just would kind of be checked out. If he got gluten by accident, he would just or if they found out that he had gluten, or if there was gluten in his foods, it's just like he was just kind of zoned out. And he would also get aggressive, have more meltdowns, a lot of behavior issues. And so same thing, I was working with him. They took gluten out of his diet. He was doing much better. And then they went on vacation to Europe. And same thing, they said, we're going to be on vacation. He's doing pretty well. We're just going to let him eat the bread there. And then same thing, he went on vacation and he was fine with the bread over there. And then he came back to the United States. They tried giving him bread and same kind of reactions. And so again, it's not a research study. It's not a double-blind placebo-controlled study, but I thought it was pretty interesting. And I thought, I was like, well, what's the difference between the wheat over there and the wheat that's over here? Because it wasn't organic in Europe. But I thought, the only difference is that Europe has banned GMOs. And so that's the only difference that I know of between the wheat here in the United States and then the wheat over there. So I thought, it must be something with the genetic modification. That's really what made me start looking into the whole aspect of genetic modification and all that's done with wheat. So I also have a number of patients who are from Japan who can tolerate the wheat that is made and grown in Japan. And if it's not genetically modified, they're fine with it. But, you know, some of them came over to the United States and found that they had very dramatic reactions to gluten. One patient had severe anxiety after she moved to the United States and thought that it might be gluten, took gluten out of her diet and noticed dramatic improvements. And so that's one thing that with that particular, you know, with a number of patients that I've seen from Japan, that they can tolerate the wheat that's grown in Japan, but they can't tolerate the wheat that's made in the United States. And again, you know, I think the difference with that is that Japan has banned GMOs. And so if it's produced in Japan, then, you know, it shouldn't have the genetic modification and the glyphosate. So, you know, I think that that is an issue for some people in terms of the issues with gluten. So those are some other things. Oh, and just to let you know, I'll be wrapping up soon. I just want to remind you that we offer no charge phone consultation to talk with me personally about any health concerns that you may have. So again, arranging a consultation is very easy. You can just call our office at 808-783-0361 and let our staff know that you're interested in a no charge phone consultation. So again, so some of the issues with gluten, like I mentioned, is that, you know, there are a number of different ways that we can test for sensitivities. Some people really do best if they, you know, do an elimination diet and take gluten as well as other potentially cross-reactive things with gluten out. So again, you know, one of the other things that I want to mention in terms of gluten is that, you know, there's a lot of confusion in terms of different types of tests. And again, many of my patients have gone to their conventional medical doctor and they may only test them for, say, a wheat allergy, or they may test them for only the celiac disease markers. But you do have to keep in mind that there are many other ways that people can react to gluten. And just keeping in mind that, you know, take-home points, that gluten-free diet is not necessarily for everyone. And, you know, just because it says gluten-free, it's not necessarily healthier. So I think that's where testing and a careful history can be very important. So, so I want to thank you for being here. I appreciate the opportunity to let you know about the often confusing world of gluten. If you still have questions or concerns and would like to talk with me again, you can call our office to arrange a no-charge phone consultation. And you'll find the contact information for our office on our Facebook page. And mahalo, and we'll see you in 3 weeks. Again, we'll be taking a week off for Labor Day. And our next Facebook Live event will be on September 10th. Aloha.